So, you've got a fasting blood sugar test coming up? You might be surprised to hear this, but what you do the night before, well, that's pretty much the most important thing for getting an accurate result. And that's what we're going to break down today. Everything you need to know to absolutely nail it. Maybe your doctor ordered it, or maybe you're just being smart and proactive about your health. Either way, you're in exactly the right spot. Because here's the thing. An accurate result is what leads to good medical decisions. And it all, and I mean all, starts with getting the prep right.
You know, it happens all the time. Someone gets a result that's kind of surprising and their first thought is to worry. But so often, it's not actually a big health issue, it's just a simple, totally preventable mistake in the prep. Our goal here is to make sure that doesn't happen to you. We want the number you see on that lab report to be a true reflection of what's really going on.
Okay, so first things first. Why all this fuss about not eating? What's the big deal? Let's get into the why behind the fast.
The key here is that phrase, baseline glucose regulation. See, we're not interested in the glucose spike you get right after you eat a meal. That's temporary. What we really want to see is how your body manages sugar when it's left to its own devices, in a resting state. That's the clean, clear signal your doctor's looking for.
Here's a good way to think about it. Testing your blood sugar right after a meal is like trying to check the traffic in a major city during rush hour. It's just chaos, right? You can't tell what the normal flow is. But fasting? That's like checking the traffic at 3 in the morning. It's calm. It shows you the fundamental, baseline operation of the whole system. That's the signal we need.
And wow, getting this signal right is more important than ever. Get this, almost 600 million adults around the world are living with diabetes. And what's crazy is that a huge number of them don't even know it yet. So this simple test, when it's done right, is one of our best tools for catching things early.
All right, let's get practical. This is the step-by-step guide, your game plan for walking in there and getting a totally accurate result. So let's walk through a typical timeline, okay? Let's say your test is at 8 in the morning. That means you want to be done with your last meal by 8 p.m. the night before. See, that gives you that perfect 8 to 12-hour fasting window. And here's a pro tip for you. Book your appointment for as early in the morning as you can. That way you literally sleep through most of the fast. It's so much easier. Okay, this is where things can get a little tricky, and it's where a lot of people make mistakes. The rules are super strict, but for a really good reason. You can have plain water, and in fact, you should drink plenty of it. It keeps you hydrated and can make the blood draw way easier. But here's what's not allowed. Literally any food. No juice, no soda, and this is a big one, no coffee or tea, not even black. And definitely no gum or mints, even the sugar-free kind. The sweeteners can sometimes trigger a response. And of course, no alcohol or cigarettes. So beyond just when you stop eating, there are a few other things to keep in mind the night before. First, just eat a normal dinner. Don't try to game the test by having some super light salad or a huge feast. Just be normal. Second, definitely skip any alcohol for a full 24 hours beforehand. Third, try to get a regular night's sleep. And fourth, avoid any really strenuous, intense exercise. Both poor sleep and a killer workout can ramp up stress hormones, which can actually raise your blood sugar. All right, we've covered the to-do list. Now let's talk about the don't-do list. These are the super common mistakes that can completely throw your numbers out of whack. This is probably the number one thing, the just a little bit mistake. People think, oh, what's a tiny splash of milk in my coffee gonna do? Well, it's got sugar and fat, and boom, your fast is broken. Same with chewing sugar-free gum. Another one is forgetting that a late-night snack totally counts. You have to start your fast after that. And believe it or not, you can actually fast for too long. Go over 12 or 14 hours and your body can start doing weird things that skew the results. And finally, don't underestimate stress. Seriously, if you're super anxious on the morning of the test, your body pumps out cortisol, and that can legitimately raise your blood sugar.
Okay, so you've done all the prep, you've gone in for the test, and now you've got a number. Let's take a look at what that number actually means. And the key here is, don't panic.
These are the official numbers from the American Diabetes Association, so this is the standard everyone uses. It's pretty straightforward. Anything under 100 milligrams per deciliter is in the normal range. If you're between 100 and 125, that's considered the pre-diabetes range. And a result of 126 or higher, and this is key, on 2 separate tests is what's used to diagnose diabetes.
So if you look at it visually, you can see those 3 zones pretty clearly. You've got your normal zone, that middle pre-diabetes zone, which is like an important warning sign, and then the diabetes zone. It's just a simple way for you and your doctor to see exactly where your number lands. Okay, listen up, because if you take away only one thing from this whole explainer, let it be this. 1. High, Number is not a diagnosis, it's just a single data point. It's a signal. Your doctor will always want to do a second test on a different day to confirm things before ever making a diagnosis. So please, I'm serious, do not spiral or panic over a single reading.
And hey, if your number does land in that pre-diabetes range, try to shift your perspective. Don't see it as a bad thing. See it as an opportunity. It's your body's early warning system, giving you a heads up that it's a great time to make some positive changes. And the good news, this is often a reversible stage.
But what if you do everything right? You follow all the rules, and you still get a weirdly high number. It can be so frustrating, but there's usually a reason why. It turns out, other things besides food can affect your numbers.
So we already talked about stress and poor sleep, which are huge, but also just being sick. Even a simple cold puts your body under stress and can raise your sugar. Being dehydrated can make the glucose in your blood more concentrated, and some medications like corticosteroids are known to push your numbers higher. It's so important to tell your doctor about any of these things when you're talking about your results.
And then there's this really fascinating thing called the dawn phenomenon. Basically, between about 4 a.m. and 8 a.m., your body gets ready to wake you up by releasing a little cocktail of hormones. And that hormone surge tells your liver, hey, release some glucose for energy. For some people, that can cause a little spike in blood sugar right around the time they're getting tested. It's not something you did wrong, it's just your body's natural clock at work.
Phew, that was a lot of information. So let's boil it all down. What are the absolute key takeaways to help you move forward with confidence?
If you only remember 3 things, make it these. 1. Nail that 8 to 12 hour fasting window. 2. During that fast, drink only plain water, nothing else. And 3, and this is the most important, remember that a number is just a number. You have to talk it over with your doctor to understand what it means in your specific context.
And that really brings us to the final point. A single test is just a snapshot. It's one picture on one day. The real story of your health is told by the trend over time. It's like a movie, not a single photo. That's why tracking your numbers is so powerful. It helps you and your doctor see the patterns and understand the bigger picture, connecting the dots between your results and things like sleep, stress, and what you eat.
You should be. You've got the checklist, you know the common mistakes to avoid, and you have the context to understand your results. You're not just passively going in for a test anymore. You're an active participant, prepared to get the most accurate data possible to take charge of your health. You've totally got this.